Okay, and our final presenter is Babu Bhattacherjee, who's from Poplar, HARCA in East London, and to my mind, the exemplar community-based housing association. If other housing associations were a bit more like yours, perhaps that whole movement would be something very different indeed. You've also been one of the pioneers of neighbourhood community budgets, and I look forward to hearing what you have to say.
Steve introduces people so beautifully. I kind of feel that, you know, next time I have a date, I want to bring him along for the early part of the evening just to set the scene, you know, because it did me a lot of favours. Okay, I'm going to talk to you about community budgets. First of all, sort of tell you a bit about us. So we were founded in 1998. We're a stock transfer housing association. We manage about 9,000 homes. The name HARCA, Housing and Regeneration Community Association, means that we really value not just the homes that people live in, but the lives that people have, and try and make those lives as prosperous and I guess fulfilling as we can. And I guess part of that is we're a resident-led organisation, so residents have a majority on our board. They help to create us, and they help to fuel what we do for the future and what we've done up to now. We offer services to about 40,000 people, so we have a scale, I guess, you know, which I think we try and utilise as well as we can. And part of that is that we are also very small geographically. So we only cover about 3.5 square miles. We only cover 3.5 wards. So we're quite local. We only care about Poplar. We only care about that area. None of us are going to move to Westminster and start managing properties there. So you know, it's all about kind of what we do in this area. And something about this area. It's the heart of London's poverty, or it was the heart of London's poverty. So in 2007, our wards, the three main wards that we're in were first, second and sixth in the most deprived list of London wards. In 2010, that's changed. We're now number 2, number 12 and number 24. So in some part, we've helped to make that change as time has moved on. And I think we've seen some incredible opportunities that we've managed to take hold of. There's something to understand about relationships at local level. They're really complex. We have a coalition government. Don Foster, I think, made the case very well about the progressive end of a coalition government, but we have a coalition, and that's complicated in itself. We have the Greater London Authority. If you get down to the local level in Tower Hamlets, we have an independent mayor, and we have a Labour majority council. So there's incredibly complicated relationships going on. And if you want to make change in a place like that, in an environment like that, it's not easy. And it's not quick either. It takes a while. And to be honest, it's not cheap. So, you know, I know we're talking about austerity and kind of value for money and changing things. And I don't mean cheap I don't mean expensive in a financial sense. I mean it takes a lot of resource, it takes a lot of time, it takes a lot of effort from people to change things that haven't been working well for a long time, to find the spark to change that, to convince people. And I guess if I was going to kind of explain the personality of our place, of our residents, and I guess kind of, you know, I heard what Neil said about not calling yourselves resilient, so I won't say that we're resilient, but I think we are an optimistic place. I think we look forward to the future. I think we're very keen to see what we can do. I think we're inventive. I think we look to see what we can do. We look to changes to see what we can do. I think, to be honest, we're quite manipulative, and you can sort of see in the environment we operate in, you've got to be able to get people to see your point of view. You've got to get opposing forces, and there are several kind of forces in the list I told you earlier that don't always see eye to eye from each other and with each other and are looking to outdo each other in some way. So we've got to kind of keep them all sweet and kind of make sure that we get what we want as a community, as a group of people from that relationship. And to be honest, we're kind of quite muddling as well. So we don't always know the right way to do things. So we're kind of feeling our way along. Sometimes something works, we'll give it a go. If it works really well, we'll do more of it. And this idea of a kind of really coherent strategy driven from a central position, I don't think is really us. I think we're trying lots of different things. Our residents are trying lots of different things. And sometimes we hit success, we hit gold, and then we just try and keep going and use our kind of force of personality, our optimistic view to keep it going. So, community budget. Okay, so we are one of the 12 pilots. We're one of the 12 neighbourhood pilots for community budgets. We actually think this is right. This thing about local public services can be better, more effective, more efficient when they are designed, co-designed in an integrated way by residents and those agencies and others. And that's the way we've worked. We've always kind of worked to get opportunities, situations. We change it through the force of partnership. We change it through the force of our residents. I mean, one great thing about having such great links to residents is that we kind of exploit it mercilessly in the sense that we will use our force of numbers to kind of lobby the town hall, to kind of have lots of people at public meetings, to really kind of reach our community, to talk to people, and to get that community to react to what's happening around them and to influence and change what's happening around them. And community budgets seem to us to be a really good way of doing that. And to be honest, I work in a housing association, and so you would guess that the thing we would spend our money on most is housing. But actually, the thing that attracts me to community budgets is kind of the possibility that actually I shouldn't be spending my money on housing. I should maybe be spending it on education, on young people, or health, or something else. I mean, we should be open to the possibility. The thing that drives us, the kind of thing that it says on the tin, actually, we need to maybe think there might be other ways and better ways of achieving our ends that aren't just by that fundamental one-trick pony approach. So, with community budget comes this thing of spend mapping. I mean, what do people spend their money on? So we focus on 2 wards in our area. So we focus on Mile End East and Bromley by Bow. And in that area, there is something in the region of 245 million being spent on various stuff, and the stuff's all listed here. So we've mapped this. So we kind of, sent the accountants and statisticians and whatever out looking at what things are spent on. So there's an incredible, and this is 2 wards in London, incredible amount of money being spent, and you can see the kind of range of things that it's being spent on there. So what we wanted to do next is kind of do the community bit, kind of what do people think? What's the co-design thing that's going on here? So we went out and we spoke to over 1,000 people, and we did it in a way that wasn't just the kind of people that we knew. I said before about how we know how to get a crowd together and to get them to lobby for something, and to work with us and to kind of get what we want. But this was a different approach. We wanted to talk to people that we didn't normally know, and we got a group of people out consulting on bus stops, on buses themselves, outside school playgrounds, just to try and catch people we wouldn't normally catch before. We've got a very large Bengali community, and one of the ways in which that community is contacted and engaged with is kind of through Bengali TV stations. So we started to do some TV kind of sessions for that community. Very interesting, really kind of raised our profile within that community, and just an interesting way of doing things. The upshot of some of that was not only did we get to know what their priorities were and what that community felt in terms of public service, but we also got 300 people, the vast majority, probably 200 plus, who had not offered to volunteer before. So these were people who were saying, like, actually, I want to be involved in this. I want to be involved in this community budget process. So that's kind of over a quarter of the people that we spoke to. We're all saying that actually, kind of sometimes just let me know what's going on. I just want to know what's going on. Keep me regularly informed. Down to, I want to help deliver that service. I want to help deliver services for our community. I want to be part and parcel of that. I want to do it every day. So you're starting to get this sense of where your community really works. And sometimes you get this, I hear stats kind of bandied around about how many people really want to get involved in local services, and some people say, like, it's 10%. Yeah, it's 10% of the community that really wants to do that. I mean, actually, I think the number's far higher, but I think we have to probe at what level they want to get engaged. And I think sometimes it will just be, actually, just keep me in touch. I just want to be able to have my voice. For others, it'll be a much more active and engaged and participative process. Okay, so we now come to the big priorities that they examined. So we looked at health, we looked at employment, and we looked at education, and together with the community, we looked at the co-design process, which really helped us to focus down on health. And we look at some of the problems here. We've got some really kind of high hospital admission rates and some of the highest hospital costs per head of population in Tower Hamlets. So we've got some really serious issues that are going on here, and we knew that's what we needed to tackle. We helped through this process to focus on diabetes, and we've got some stats here about why diabetes was the issue we focused on. It was something that affected our residents in their daily lives. It was something that actually affected 8% nearly of the population, and that's numbers that are going to grow. And it's the consequent problems that diabetes creates. It creates depression. It means that children in those families don't get a parent who will actively engage with them. It can lead to loss of employment or not having employment. And we knew that actually this is something that we can tackle through a combined approach. So the sorts of things we were looking at is incorporating the sorts of work that we were doing anyway. So it's our work on employment, it's our work on housing, it's our work on welfare benefits, it's our work on volunteers, community champions, engaging with people, and it's linking that directly to the GPs and what they're doing. So rather than just looking at a simple diagnosis and then sending people off, we looked at a whole kind of person package, and we really wanted to see how those different agencies work together. So interestingly, the agencies that were operating weren't doing anything wrong. They're all doing things that are very valuable, but they weren't doing it together. We weren't doing it together, and that was the opportunity that was really presented to ourselves. So we looked at what we could put into this. So the budget numbers are around £1 million. So not all this is cash. In fact, the vast majority of this is in kind, but it's focusing this money together to get us the kind of outputs we want. And we could see the kind of outputs that we were going to get. We were going to reduce the number of people who are going into secondary care, reduce the number of people who are getting type 2 diabetes, improve awareness, and there's some really practical things around employment, accessing volunteering opportunities, increasing the quality of life, and training people up, so that what we don't get is you can manage your condition, but it's also about how you then kind of manage your life around that condition, and also how you manage the circumstances of the family around you. We have some clever policy people and kind of people who can do this social return on investment stuff to look at a really detailed cost benefits analysis. It's all been through the rigour of government analysts looking at this, so it's all verified. For every £1 that we put in, we get £12 worth of social return on investment, and 5.6 of those pounds are direct fiscal benefits. So we're talking about cash that is accruing to the state in one form or another, whether that's through reduced benefits or it's through savings to the health service or other services. So there's some real obvious benefits to this approach. We're looking at non-quantifiable benefits as well, so improved health status, better use of healthcare, reducing barriers to access. So there's a load of spin-off benefits as well that we couldn't quantify, but we know exist. So that number, that 1 in 12, is probably even better. So those £12 could be much, much better. So do we think that devolving budgets can produce better local services? Definitely. Is it something that we're already doing? Probably. Many of the agencies in this room are doing just the sorts of things that will make community budgets work. The problem is linking it together and doing that long and quite arduous work of bringing the partners around the table and getting them to understand the value that this process brings. Thank you.